Okay, class, so right now we're going to talk about patient education and health literacy. And as nurses, it's our responsibility to not only present health related information to our patients and their families, but we need to ensure that they have the ability to comprehend and then integrate the information that we're giving them. To be able to teach effectively, we have to recognize that patients, families, and other members of the healthcare team come from diverse cultural backgrounds, and that it can include socioeconomic, age, and educational levels. And we need to recognize that each person, patient, family, has a different ability to comprehend healthcare information. So, we're going to use a term which is called health literacy, and it's defined by the American Medical Association as the ability to obtain, process, and understand basic information and services needed to make appropriate healthcare decisions and follow instructions for treatment. Another way that can be worded is that globally, when we look at a global definition, it's that the degree to which an individual has the capacity to obtain, process, and understand basic health information, which will enable them to make appropriate healthcare decisions, and that services needed to both prevent and treat illness. So it is a big buzzword right now, the term health literacy, because we are wanting to be able to assess someone's health literacy and to add and to encourage and to evolve patients' health literacy, because we believe that that will help them be a more integral part of their healthcare process and will make them be able to become healthier individuals and be able to understand and follow treatment recommendations. So, nurses have to be aware of the concept of health literacy, and we have to understand that it impacts every patient and it impacts the care we give that patient. Patient education is one of our primary responsibilities. That means that we have to understand how to explain and give instructions to both patients and families so that they can readily understand the information. But we know that research has shown us that the instructions are frequently misunderstood and sometimes resulting in serious errors by patients and families or noncompliance due to lack of understanding. Because we have some direct contact with patients and families, we need to take this role very seriously, and we need to learn how to provide the most appropriate and most effective type of health information or patient education to improve the health literacy of our patients and families. So what is some of the role of health literacy in nursing? So these are some expected outcomes if we were to address health literacy, that we would want patients to be able to read and identify credible health information. We'd want them to understand how to make appointments. We'd want them to understand perhaps how to fill out their forms. There are multiple forms, and if they don't understand how to fill them out, we're not going to get the information needed to provide safe, effective, quality care for those patients. We want them to know how to gather their own health records and how to be able to ask appropriate questions of their primary care provider. We want them to be able to advocate for appropriate care. We want them to be able to use technology, as well as the others listed here. So there are two types of patient education that we think about, and we need to know that this education can take place in both a formal and informal settings. So formal patient education might be delivered in a community forum, media, educational, or group settings. They're often goal-directed. They're one-on-ones. They can be one-on-one sessions with patients in the acute care. Generally, with formal education, we have a specific goal that the educator wants to accomplish, and there's often the nurse and the patient involved in this formal setting. However, we can have family and other members of the healthcare team. There's also informal education, and this is usually learner-directed or patient-directed. And this occurs when patients ask questions related to medications, treatment, or procedure. We also need to know that there is teaching which is how we impart the knowledge or giving the instruction. And then there's the learning, and that's the process of acquiring the knowledge or the skill. So this is an example of sick day guidelines we might want to teach a patient in a formal type setting related to one specific area, such as sick day guidelines for people with diabetes. So these would be the things we'd want the patient to understand and be able to let us know that they have understanding of what each of these means. We might see this when we're giving a patient a new medication, a new diagnosis, or a new treatment. There are different domains of learning. There's the cognitive domain. This is where we learn to memorize or recall information, and the learner needs to be able to do this in order to progress to the next stage and to comprehend the information that's given them and to be able to apply and analyze and synthesize the information. Learners often in the cognitive domain, this is where they get new knowledge. This may be their first time learning, and then they're going to recall the information. They often will categorize and evaluate and make comparisons to previous knowledge that they've had to help draw conclusions of this new content. Then we have our psychomotor domain, which is teaching a new skill, such as a diabetic learning how to check their blood sugar, patient newly diagnosed with hypertension learning how to measure their blood pressure at home. We demonstrate or show them how to do it, this new skill, and then they re-demonstrate it back for us, where we're looking for the ability for them to perform the psychomotor needed activities to do the task. And then we have our affective domain, which is where we take into account or look at feelings, values, motivations, and attitudes towards this new education or this new learning concept that the patient, or could be even nursing student or new nurse, needs to acquire. And we know that any of those can either create a barrier or enhance the learning of the person in which we're teaching. We also know that there are various learning styles. We have to look at the multimodal learner, which means that we need to teach in more than one learning style in order to help maximize learning and recall. If you look at the picture, we see the patient is physically learning to do their IS. The nurse is probably giving verbal instructions on how to accomplish it, and laying there on the table is probably a written instruction on how the IS works for her to refer to later and for the nurse to share with the patient. In this particular picture, we're looking at 3 different modalities to teach this patient how to use their IS. In using a multimodal concept, we have found through research that people learn more effectively. We also have to learn about diversity in terms of how that can affect a patient's health literacy. So there is the lifespan, the age of the patient. As you learned in psychology, each of us go through different stages of cognitive development, and we need to make sure that how we present information and the type of information corresponds with that cognitive stage of development that a person is in. We know that we need to know somebody's reading level or learning style and readiness if we're going to provide learning material, because we want to meet them at their level. We want to understand if there are any culture or religious considerations that need to go into what we need to present or how we need to present our health information. There are some cultures in which the wife may be your patient, but in her culture, the husband needs to be present to receive the information, and he will be the person you're directing the learning at. We need to determine if there's any language issues or values that could inhibit the learning or understanding. We have to realize that there are cultural and religious practices that may interfere with certain medical treatments, and adjustments may need to be made. Patients may have disabilities that we need to factor in, and there may also be physical impairments, learning disabilities. Perhaps someone has a vision impairment or a hearing loss, and so we're going to have to look at different alternatives to be able to teach them the information that they need. We might need to look at economic resources. So, for example, if a patient has limited health care insurance and no prescription plan, they might not be able to obtain their medication in order to take it. And in that case, we would need to find supportive services so that the patient can get their medications and then be able to effectively follow through with their medical treatment. So we know evidence-based practice. We know that we want to advocate and encourage the active involvement of the patient and their families, because we need them involved in order for this to be effective and for treatment to be effective and to improve somebody's health status. We want to make sure that our information is easy to understand. We want to be sure that we're using multiple teaching methods because we have different types of learners. And we need to assess our information, especially after we've done 2 to 3 key points, to make sure that the patient is understanding where we're at. And this will also help us interpret whether the patient is still engaged in the process that we're doing. And we also need to review what a patient may come already knowing, or if we're doing consecutive teaching sessions, what do they remember about the last one? This allows us to clear up any points that they did not understand from the previous teaching session. It also helps us understand, perhaps maybe we can alter how we present the information this time so we get better recall. And it keeps us from presenting information that somebody may already know. And when we present information that people already know, that you tend to lose their attention very quickly, and they may not be mentally present at the next stage of information, which may be the new information. Just a quick quiz. I want you to think about this question and then answer it and on your notes. So we're going to do some patient behaviors. These might be in an assessment. You might come across one or more of these that might let you know that someone might have a health literacy deficiency. So they may tell you they left their glasses at home, so they might not be able to read the information themselves. They might not complete their forms, or they might do it inaccurately. You might have a patient who misses multiple appointments. Maybe they don't comply with their medication regimens, and maybe they don't follow through. Some questions that you can ask a patient when you're doing a health literacy assessment. Who will be taking care of them at home? Who else besides the patient do they believe we should be educating? Perhaps what do they already know? Do they have access to the internet? Some people don't. Some people don't like to be on the internet. Some people don't want to get their information on the internet. Do they read? Do they read books? Do they read the local paper? Often when I have someone who doesn't read at all, it makes me wonder, in a way, what is their reading level, and it causes me to reevaluate whether giving them written materials to read will be very effective, especially if they're challenged at reading. These are just some other questions. Asking if they're in pain or having discomfort. We know that if we're in pain or we're stressed or under anxiety, we don't hear or learn as adequately as if we are in a more relaxed state. So if you were working at increasing somebody's health literacy, or health literacy was something you needed to address in the clinical setting or in the community setting, these are some examples of some nursing diagnoses and what it might relate to. This might be a care plan you might see. So this is related to its self-administration of insulin. It's a newly diagnosed diabetic patient. And the patient has also verbalized they're afraid of needles and they have elevated blood sugars at home. What would we like the outcome to be? Is that the patient will demonstrate proper technique to draw up and administer their insulin. So some interventions is we're going to determine the patient's knowledge first of the medication and their baseline understanding of how it's administered. And then we are going to adjust what needs to be taught based on what they already know. So here's another quick quiz question. After you finish, or if you know it while you're going through your notes, go ahead and circle what you think the right answer is. So we know that collaboration and delegation, we never get out of that. So these are just some ways that we collaborate and delegate parts of the health literacy pendulum. Are there things we need to consider when a patient goes home? So if we're at home, remember we're always a guest. So, and we need to understand the environment in which we're providing the teaching. We want to make sure that some stress for the patient, maybe if it's covered by their insurance, if supplies are covered, those types of things, because they may not want to participate in the new activity if they can't afford it or it's not going to be covered by their insurance. It can be not everything is covered, and so we need to be sure we understand that so we're not creating stress for the patient related to this new activity we need to teach them about. And we really want to be sure that we're documenting what it is that we're doing and what the teaching plan is and what goals have been met and what progress toward those goals we've already made for the person who follows behind us. So like I said, the patient isn't getting the same information 5 times, and we're missing the information that also needs to be addressed, but everybody keeps repeating the information that's already been taught. So good documentation and patient response to the teaching. This is an example of this patient needs to learn how to check their pulse and blood pressure before they take their medication. So we need to know their health literacy, what is their learning style, readiness, what is their health belief about this? Do they believe that by checking their blood pressure and checking their heart rate, it will have a positive impact on their generalized health? And if they don't believe that this will help, they will not be an active, positive partner because they're not a stakeholder in the process. So do they have support systems? Do they have someone who can help them and encourage them? And are there any barriers? So a goal is that the patient will be able to demonstrate this, and the patient will be able to verbalize an understanding of why they need to check and how to record the information. Another quick quiz. So we need to remember the 3 A's of healthcare information should be provided to a patient or a caregiver should always be accurate. We want to be sure that we're using accurate information. If we don't use accurate information, we will lose their trust. The information needs to be accessible. That means we need to have, other than our words, we need to have some type of resource that they can refer to about the information we're presenting. And it needs to be actionable, which means that the patient needs to be able to integrate it or use it. That it's just not for them to read and understand, and it has no direct impact on their health. We have to be sure we understand the environment that we're teaching in. Is it a group or an individual? Time of day can have an impact, and interruptions. We want to make sure that we do things one idea at a time, and we want to monitor for learner and teacher fatigue. Both, if either of these develop or both develop, it can negatively impact learning. We want to be sure that there's integration of the data. So we want to give time for the learner to process and integrate the new information. We want to be sure we're using basic terminology that is understandable to the learner that we're faced with. We want to use familiar concepts. We want to provide examples, and we want to use at least 2 different modes of learning. So if we're going to present new information, it should be reviewed at the end of the session. So this allows us to adequately evaluate the information that's been presented. We also want to be able to leave time for questions and any demonstrations that need to be done. For example, if a patient has 30 minutes to come in to get some education on how to use their glucometer, and the nurse educator presenting the information takes 25 minutes of that time just going over in written form and her demonstrating how to do it, and there's only 5 minutes left for the patient to do the hands-on or demonstration or even ask any questions, then the learner may be frustrated. They may not have retained it because they weren't able to clarify what they didn't understand. The educator can't effectively evaluate the education session because she hasn't allowed the learner to show her or to give her feedback on what they have remembered and that kind of stuff. So always allow time for questions and demonstrations. Don't rush the learner. Teaching sessions should include topics and skills to be reviewed. We need to know what method we're going to use and if there are materials that we're going to give, and we need to record the patient's progress. And that's the end of this.